Welcome to this episode of Youth Diary. I'm Deepa and today we have with us Dr. Vijay Mohan, who is an orthopedic surgeon and he's associated with Aster Medicity, Cochin. Welcome to the show, Doctor.
Thank you.
The first question goes like this, how do we understand that it is a fracture? Many times when we really meet with an accident or when we fall down, we don't really realize that it's an fracture. So it's a fracture, I'm sorry. And what are the symptoms of a fracture and how a fracture can be diagnosed?
Fracture basically means breakage of bones. It's very difficult to miss a fracture unless it's very tiny and displaced fracture. So obviously you'll have pain, then you'll have swelling at the site of fracture, and usually you'll have deformity or like movement like crepitus you feel on the fracture. Especially if it's a long bone fracture, many major bones is fractured, you can never miss it because you won't be able to stand on a fractured limb and you won't be able to use a fractured upper limb. So usually it's very difficult to miss a fractured limb, but very small joints like wrist joints or in the foot bones, you can miss a fracture. Then you have to go for an X-ray and find it out.
So what is low back pain and what causes low back pain?
Low back pain is a very common symptom nowadays. Like, have you ever had back pain?
Yes.
So 90% of the world population will have back pain once or twice in their lifetime. That's estimated. And back pain is the fifth most common symptom, like your fever, your cold, like that. Back pain is the fifth most common that a patient comes to the OPD. If you look at the orthopedic OPD, 50% of the patients come with back pain. And what causes back pain, if you analyze it, there are a lot of causes like inflammations, infections, disc problems, or tumors, cancers, or fractures, or osteoporosis. We can list a lot of things, but all these things together forms only 20% of the causes of back pain. So that means 80% of the people who have back pain doesn't have a reason for that. So we call it, in medical terms, we call it simple back pain or mechanical back pain. So if you look at this, back pain basically arises from the backbone.
Next question is this.
Hi, I'm Reshma. I'm from Dowling Group. I have a doubt. What are some common knee problems? How they are diagnosed?
It's knee problems. Basically, a lot of people, again, other than low back pain, next common thing patient comes to OPD is with the knee pain. And what are the causes? Again, like we already discussed, like arthritis or infections or inflammations or trauma, all these things, this kind of arthritis. How you diagnose a knee pain is, first and foremost, is a clinical examination. You have to examine, there's a specific way of examining the knee to find out. Knee being a superficial joint, most of the structures inside the knee can be palpated with your finger. So majority of the diagnosis of knee problems can be done in an OPD by clinically examining it. And next option is to go for an X-ray. And X-ray will give you a clear picture about the joint stature and structure of bone and any problems in the bone, all these things will tell you. And certain conditions like ligament injuries or meniscal injuries or some cartilage injuries, those things will not be visible in an X-ray. So then you have to go for an MRI. And again, some inflammatory conditions or infectious conditions which you cannot diagnose with X-ray or MRI, then you have to go for some specific blood test. So clinical examination, certain blood test and X-ray examination, and very rarely MRI can diagnose most of the knee problems that we usually come across.
With the changing lifestyles and all, becoming more fashionable, I think we're just forgetting about the regular exercise regime and all. So doctor, can you just throw some light on the requirement of a healthy lifestyle, including the gymming activities and other exercise and all?
If you look into the OPD distribution, I would say 60 to 70% of the people come with diseases caused by the lifestyle. Whether in orthopedic OPD or cardiology OPD or general medicine OPD, even your diabetes, your hypertension, your cholesterol levels, your heart attack, your neck pain, your back pain, your knee pain, everything, like majority of them are related to your lifestyles. If you look at maybe some 40-50 years back, they were completely healthy till they died. They used to die at 50-55 years of age, but they used to die of maybe heart attack or maybe a cancer or maybe some infection which we didn't have antibiotics to treat. But till the time they died, they were completely healthy.
Oh, they were not getting any disease because of the lifestyle?
Yeah, they were completely healthy.
Healthy, right.
And there was no doubt about use of coconut oil at that time, but we started debating all this is now. So what happened now is like a lot of advancements came in technology, life became more faster, We had more vehicles to transport us. So we started, like, we stopped walking, we stopped running. So muscles get exercises when you use them. So we are not using our muscles. So that's why we started getting knee pain, back pain, neck pain, those things.